Hi, it's Dr. Bill Capicotto, your favorite minimally invasive spine surgeon. And I'm going to show you a case of a gentleman that I took care of many years ago before I was a minimally invasive spine surgeon. And I've been in practice for 38 years. I went into practice in 1986, and back then spinal fusions were quite a bit more primitive than they are today. Today we do them through little small tubes or tiny incisions. Back then we had to make large incisions and use retractors that looked like they came out of the medieval times. So this is a gentleman that had chronic pain. I fused his spine over 2 levels. He probably had 2 or 3 operations over about a 6-year period. And what I wanted to show his MRI, this is the MRI of the lateral MRI, this him from the side. And this is the skin on his back. And he's got a layer of fat, and this is the fascia or the envelope that covers the muscle. And this is all scar. This is an area where there was spinal musculature. Good old-fashioned, all-American spinal musculature. And after having these operations, this is one big scar. There's no muscle here. It's non-functioning. And if you were in the operating room with us and looked at it, it'd just be white, fibrous tissue. This is a picture of a cross-section. In medicine, we call that the axial. But this is the skin on his back, a little layer of fat, and this is the fascia or the envelope around his muscle. This is muscle. This is muscle. This is all scar. Here's the spinal cord where I decompressed it. But what I wanted to show you is that the operations did work and they fused the spine. However, they were disabling. For many, many people, they were disabling. It was because of one of the reasons was due to all the muscle destruction that happened. So now, with the smaller incisions and the tiny tubes, we're not tearing out muscle, we're not destroying muscle. So the health of a patient's back is much better, and their chances for having a more normal life after a spinal fusion are far greater than they were in 1988. So I thought that you should see this. To me, this is very instructive. And in regards to the surgeries that we do now, the minimally invasive, it's quite inspirational to know that this doesn't happen anymore. And I think I know that's a great thing for our patients. I just showed you a patient that I operated on back in the late 80s. And I would say the classic way, the old-fashioned way of doing spinal surgeries, and the amount of destruction of the lumbar musculature, which was extremely disabling. This is the MRI of a patient who I did in a minimally invasive fashion, and I want you to look at the muscle here. He still retained all the muscle. Here's the screw heads. Here's the screw heads. Right, and my assistant can click down a few clicks and we see a few other pictures. So we see the muscle. The muscle's been preserved. That's a big deal. That's where little incisions make a big deal. So all this muscle still works. And the muscle goes all the way up the back. Now, my assistant come over to the right or left. Here. A little more. Now, look at this. The muscle goes all the way up. All the way up. There's no destruction. If you remember the last MRI I showed you, this was all scar. And that was hugely disabling. This is all sparing of the muscle, and that muscle is needed for the entire health of his back because that muscle runs all the way up. So anyway, I thought you should see this. It's for me, it's very important for you to understand why we do what we do. So have a great day, and we'll see you soon. Thanks.